Hello and welcome to another edition of 12 Health. I'm Shannon Hegy, and today we are talking about the T1D, Breakthrough T1D Children's Conference in Washington, D.C. that happened from July 7th through July 9th. And joining me today to talk about it is Maddie Debenedetto from Cranston and her mom, Shelly. Maddie was actually one of the delegates at this conference this year. So I want to thank you both for being with us today. Maddie, before we get into what the conference is, why don't you tell us your journey and when you were diagnosed with type 1 diabetes?
So I was diagnosed in 2018. I was 7 years old. I think it was in June, and around like the time of April, maybe late March, I started like getting the early symptoms of like constantly being thirsty, constantly having to pee. And eventually I started losing a lot of weight, and then that's when my mom took me to my primary care physician, and they did send us to Hasbro Children's Hospital, and that's where I was diagnosed, and I think I was there for a couple of days.
I know that you were only 7 years old, but do you remember in that moment kind of what you were thinking when that diagnosis came at you?
We don't really have a history of it in my family, so I think me and my parents, we didn't really know what to expect. And I think it was just a lot. And I didn't really know much at all. So I was kind of just confused in the moment on what was really happening.
So since that moment of diagnosis, what has your life been like? What is a daily day for you?
It's definitely changed a lot because type 1 diabetes is like a 24/7 disease. It never goes away, and you constantly have to monitor it and make decisions that really could impact your life. It could make you have a low blood sugar, make you have a high blood sugar, and that can really just affect how you feel, like mentally and physically. So I think it's definitely been a huge adjustment. I've learned to handle it well. It definitely took a lot of time. But overall, we're kind of used to it now because it has been 7 years. But it does take a lot. Every time I eat or anytime I do physical activity, there's always just another layer of thinking that needs to happen.
Yeah, so if you didn't catch that at home, 7 years, so Maddie is 14 years old. What are some of the things that, I know you're probably used to it by now, but some of the things that still for you are just, you're like, I wish I could just be a normal teenager. What are the things that get in the way, the things that are really frustrating about it?
I think one of the big things is I dance, so physical activity can really impact your blood sugar. It usually lowers it. So I think it can definitely be difficult to balance, or even if I'm just hanging out with my friends. Like the other day I was at the beach and we wanted to go for a walk to get lunch, but I now have to worry about, is my blood sugar going to drop when we walk? Wait, we can't leave yet. I need to sit before I do physical activity and have a low snack. So I feel like it's kind of just, it holds me back sometimes, and usually everyone's always very understanding of it. But having to like go out of my way and do other things that not all other teenagers have to do can be a lot.
Yeah. Do you feel like, we were talking before we began our recording here about, I feel like you hear a lot more about pediatric cancer, things like that. Type 1 diabetes just kind of seems like something that people get diagnosed with and they live with. Do you feel like there's not enough awareness about what people like you have to go through on a daily basis?
Yeah, I would definitely say so. Like, even within my close circle, like, people I've become new friends with, they don't really know anything about it. And if they have any questions, I, like, never hesitate to answer. And I always encourage them to ask more because that's important to me, that my friends know what's happening and they can help me. But I do think that a lot of people don't know. And I think another big issue is differentiating between type 1 and type 2. So a lot of people just think of diabetes as a whole, but it really isn't. It's two very different, very separate diseases.
Yeah, absolutely. It's nice that you're taking on that advocacy and awareness on your own and making sure people your age know what it is. So getting back to the Breakthrough T1D Children's Conference, Maddie was one of 170 children throughout the country with type 1 diabetes between 4 and 17 years old who all gathered in D.C. to meet face-to-face with lawmakers. And this conference happens every 2 years. It was actually started back in 1999 by a 9-year-old boy from Massachusetts who said to his mom, well, why can't kids go to Washington, D.C. and advocate about type 1? And that's how it all started. So, Maddie, how did you find out about the conference? How did you get chosen? Take us through all of that.
So I actually had applied back in 2023, I think it was. I kind of saw about it through like social media because Breakthrough T1D does have like a big participation on social media. So I had seen about it, and at the time I applied. I mean, I was a lot younger, and you do have to write like an essay to apply. But obviously I didn't get it. But then this year I wasn't really planning on applying, but I saw it and I was like, no, it's okay. But the deadline was coming up. So I was like, I'll just write an essay quick. Like, I won't like pour my heart into it. I'll just do a little something. And then the deadline actually got extended a week. So I was like, oh, wait. So now I'm actually really going to try a lot harder. So it's definitely like a long process a little bit. You have to write an essay, and you have to like answer some questions about like your advocacy work and just like about you in general and what you do. So yeah, I did apply. And then I think it was January. Does that sound right? Yeah. January, like I get like a letter in the mail, and it has like a folder with a lot of info. So I actually saw about it because I wasn't home. I was at school, but my mom posted about it on Instagram.
I should bet she was proud.
Yes. So I actually did see it through that. And obviously I was very excited. And just a couple weeks after, there was like the first Zoom call with information. So it was very exciting, definitely.
What, if you can kind of just summarize for us, what did you say? What was your voice in that essay that you sent?
I kind of just talked about like my diagnosis story and like what I've done since. And there are definitely people who are like insanely involved, and I do as much as I can. But I also kind of just wrote about how, yes, I have diabetes, but I don't let it hold me back. Like I kind of just wrote about how I like use it to like better me. Like, even though I have this disease, I don't let it stop me from doing what I want to do and what I love to do.
That's great. So tell us about what it was like to go to Washington, D.C. I know part of it was advocating and urging the Senate Appropriations Committee to renew the special diabetes program. So can you take us through what that is and what all of the kids at this conference did to really try and urge the Senate Appropriations Committee to continue that program?
Yeah, so the Special Diabetes Program, it essentially just provides funding for research, which will hopefully bring us closer to a cure, but also improves technology like insulin pumps and continuous glucose monitors. But so we kind of just talked to like everyone, all the delegates, we talked to our senators and reps about like our stories just so they can kind of get a better understanding of us and who we are, what we like to do. And then in my meetings, I did talk about like my advocacy work a little bit because we did previously make scrapbooks about like our stories, what we like to do, just to get the senators and reps to know us a bit more. So I think that was like definitely a main talking point. So I kind of brought them through my scrapbook. And then we kind of just talked about the importance and how much the SDP has already done. Like all of the insulin pumps and glucose monitors are like thanks to the funding that the SDP has provided. So since it's already done so much, I think a point that I really brought up is like, why stop now?
I love that. All right, we're going to hear much more from Maddie about her experience at the Breakthrough T1D Children's Conference right after this. Welcome back to this edition of 12 Health, where we are talking about the Breakthrough T1D Children's Conference this year in Washington, D.C., where Maddie Debenedetto, a 14-year-old from Cranston, was actually one of the delegates who got to speak with lawmakers and advocate for more services for people just like her. And what an interesting experience it's been. Maddie's been telling us all about talking to lawmakers. There was also kind of a celebrity panel of people with type 1 diabetes, including, we talked about in our first section of this, the young boy from Massachusetts who started all of this back in 1999. He's now kind of come full circle, right? He was a part of that guest panel?
Yeah, he was like a celebrity shoe designer. It was just some celebrities like journalists. There's a singer-songwriter. Yeah, it was really cool, but it was definitely cool to see like he started the Children's Congress and he's already come this far. Because it just kind of shows, like, having all the role models definitely just shows how you don't let T1D hold you back.
Yeah, I bet it means a lot and for you to be surrounded by 170 children like you who all are living with this, and then to also see adults who've kind of really shown that they can be successful with this. Like, that must have felt really nice to be surrounded by your peers and be inspired by people with type 1.
Yeah, it definitely was. Even just being around all the other delegates was so amazing because it's like everyone there understands your struggles. Like yeah, my glucose monitor might be beeping and everyone's like checking to see if it's them or if it's me. Like, it's really just so great to be around.
That is awesome. Now, one of the really cool things that happened at this conference, and we covered it here on the news, was when Mattel announced that they were releasing a type 1 diabetes Barbie. But I ended up finding out when talking to Maddie that Barbie was actually unveiled at the conference, right?
Yes, I brought it with me. Yeah, they gave all the delegates one. It was really cool because they were like, guys, you have to keep a secret because we're announcing it at 4, but they were telling us at like 3:30. It was really cool, definitely.
Representation matters. We've heard that over and over again, especially children. What would have meant to you at 7 years old when you got diagnosed to be able to go out and get this Barbie and say, oh, like, this is this giant company recognizing that there are kids like me living with this?
Yeah, I think like what you just said, like it would definitely have made me realize that it's like not just me out there. And I actually did have an American Girl doll that had the little diabetes kit. But like even just seeing this, like it's so great because obviously I'm not really playing with Barbies anymore, but there are so many little girls with T1D who are. Even just seeing it in stores will spread lots of awareness.
Yeah, that's amazing. Listen, I have a news anchor Barbie sitting right next to my desk in the newsroom, so you're never too old for Barbie. So how has this inspired you going to this conference? Because I know I read that you want to work in medicine, but you're also on the student council. So now you've had a taste of politics. You still want to go into medicine. How has this, being part of this experience in DC, really inspired you?
Yeah, I mean, like I definitely do want to go into medicine, but I think just like seeing everyone, because some people are like insanely involved, they do so much. Like I think that definitely encourages me to get more involved. And there are even some people who attended the Children's Congress in past years who have like come full circle. Now they're back as, they have a young adult advocacy council. Now they're back as volunteers from that. So I think like I definitely just want to keep getting involved as much as I can because right now T1D isn't going away. So I don't see why I wouldn't get involved.
Let's get more into your conversations with lawmakers, because before we left for the break, we were talking about the Special Appropriations Committee and really pushing for this special diabetes program that accelerates T1D research and funding at the National Institutes of Health. Who were some of the lawmakers you spoke with? Was this you speaking to them individually thing? Did you have one big room where you all would kind of step up to the mic and have your own testimony? How did that all work?
So first there was the Senate hearing, and that's when there were 2 delegates that were chosen to give a testimony, and lots of senators were in and out. But then after that, all of the states broke off to have individual meetings with each of their senators and their state reps.
That's why we see the pictures of you with Senator Reid.
Yes. So I was able to meet with Senator Jack Reed, Senator Sheldon Whitehouse, and Representative Seth Magaziner's legislative assistant. So that was very cool. And I kind of just talked to them about my story. Like I mentioned, I showed them my scrapbook that really described all of that. And I just kind of talked about how diabetes affects me on a day-to-day basis. And just, again, like why the renewal of the special diabetes program is so important and how much it's really done for everyone in the T1D community.
And I think we're seeing more and more how lawmakers are getting involved when it comes to healthcare, because so many patients, regardless of what their diagnosis is, it can be a very isolating experience, whether it's dealing with your insurance company, whether it's dealing with, the challenges that come with it. What did lawmakers say to you about your story and about having you there and knowing that you're a representative from their own state?
Yeah, I mean, a lot of them were impressed with the advocacy work I had done because I participate in the Breakthrough T1D walk every year, and we've raised thousands of dollars, like I think in total maybe 80,000 through since 2019. So I think a lot of them were impressed with that, and they were all very supportive of what I had to say, and they really did all agree that the special diabetes program is super important for renewal.
What when you're raising that money, is it for research?
Yeah, it goes straight to Breakthrough T1D, and that is mostly research. It's like a research institute. So yeah.
We've talked a lot about in the news, nationally, locally, about trying to lower the cost of drugs for a lot of people with both type 1 and type 2 diabetes. Your mom and I were talking before this started about how you're really blessed that your insurance coverage fully covers that for you. But when you were at this conference and you're talking to other kids with type 1, I bet you got a lot of stories of differing experiences.
Yeah, I mean, obviously we're just kids. We aren't really quite talking about the prices of everything. But I think everyone kind of knows that insulin is extremely expensive, especially when it's like a life-saving drug. Like without it, like it would be very problematic. So yeah, I definitely do know how expensive it is. And I think lowering that is super important because there's also talk about people who are in underprivileged areas and just can't afford that. Like there are deaths caused every year through that. So I think it's super important to lower the prices.
Yeah, I bet you made some really good friends at the conference too.
Yes,
Any
definitely.
specific ones from certain states?
I met this girl from Long Island, New York. She was really nice. I got close with her. I met people from all over, really. I think some Alabama, Idaho, California. There were a lot from California. Yeah, really all over.
And what did you guys talk about?
Honestly, like I feel like I was expecting to just go in and talk about diabetes with them, but we kind of just talked about our lives. Like I feel like it was just normal. I mean, it definitely did come up more than it would in a normal conversation with my friends. But I mean, we talked about everything. I think a lot of us were also really nervous for our meetings. So I think being able to talk to them about that was definitely helpful going into that because it can be stressful. And I think everyone was kind of feeling that.
Yeah, what about expectations versus reality when you're picturing going to DC and being in the building where all the laws are made? What was that experience like?
Yeah, I mean, I feel like I was expecting it to be like a lot more like, I don't know, like uptight almost.
Intimidating.
But, like the meetings kind of just like, they like flew. Like it just like went by. Like it wasn't, I was expecting it to be like very formal. Like it was kind of just conversation. Like everyone I met with was really nice. There were some like, there was like other staff in the meetings with the senators and everyone was just so nice and they just wanted to get to know me. Because I think it also helps because our senators and representatives have in the past supported the special diabetes program. So they already kind of understand. Now it was just kind of getting my story out there.
Yeah. What have you done? I know you talked about you've done a lot of advocacy. You do the walk. What else do you do outside of this conference in Rhode Island and at school and things like that?
Yeah, I dance and I'm on my school dance team. I'm very involved in school. I do a lot of clubs and activities. Like I'm on class council, student council. I'm in the Red Cross Club, Best Buddies. I do a lot. Yeah, school's very important to me, but I also dance. I have a dance studio, and I'm also on my school dance team, so that's a lot of fun.
That's amazing. And what do you want to see personally in the future? Obviously a cure for type 1 diabetes, but what are some other things that you really want to see happen and change?
I think also like preventative measures are super important. I know there's been some drugs and medicines that have helped delay the onset of type 1. But just like overall preventing it and delaying it for even longer is important, as well as like lowering the cost of insulin, which isn't something that directly affects me, but it really does affect so many people. And once I do age out of my parents' insurance, it's definitely a thought in my mind.
Oh, yeah, absolutely.
It's expensive. So.
Absolutely. Mom, you must be really proud.
I am. Yeah, I'm always proud. Maddie always makes me proud, but especially this week, super proud. She's got a voice and she's not afraid to use it.
Yeah, and to see her go from the 7-year-old who was diagnosed that day to the 14-year-old who's going to Washington and speaking.
For sure. She talks about full circle with other people, but she herself is an example of a full circle because now she's an advocate. And I just wanted to mention, I know she's mentioning insulin affordability, which is so crucial, but also with that is the affordability of insulin pumps and continuous glucose monitors, because without the technology, she wouldn't be as healthy as she is. Her continuous glucose monitor is what keeps her blood sugar in a healthy range.
Yeah.
All day, every day. And a lot of people aren't fortunate with insurance and don't have access to that. So that is a big piece of the SDP as well.
Yeah, it seems like even those devices have come a long way, right? From probably what it looked like when you were 7 versus what it is now.
Yeah, definitely. I still use the same brands and everything. A lot of people do change it around. And although right now I currently am on the same things, but the technology with them changes. Like now they're connected. It's called like a closed loop system. So my insulin pump essentially communicates to my continuous glucose monitor. And if my blood sugar rises, my insulin pump will just automatically correct itself.
That takes some of that. I know you talked about the constantly thinking about it. It probably helps a lot.
Mm-hmm, definitely.
What would you like to see different, like a smaller device, easier mobility with these? I mean,
Yeah, I mean, I think a longer lifespan for the devices too is obviously important. I change my insulin pump every 2 to 3 days.
Okay.
And my continuous glucose monitor does last 10 days. And there is a newer version that I'm hopefully getting on soon that does last 14. So I think it's definitely improving, but just like also smaller devices is always obviously nice.
Yeah.
But really just like extending the life of those and the accuracy, of course.
Maddie, you are certainly a bright young woman, and I know your mom is proud, but I think a lot of people out there are going to be proud, and a lot of people with type 1 just like you are going to really appreciate hearing all you're doing to advocate for everyone who's dealing with this disease. I want to thank Maddie and her mom, Shelley, for joining us here on 12 Health, and hopefully we'll see you again at another conference. Are you allowed to go more than once?
I wish.
Well, thank you so much for joining us for this edition of 12 Health.